guys, it's your girl Shalae and I'm back today with another video. In today's video, we're going to be discussing Medicare decreasing in 2023. We're also going to talk about open enrollment and so much more. So if you want to know all about the world of Medicare, you already know what to do. Stay tuned. Your girl's got you covered. Now, if this is your first time tuning into my channel, hi, hello, hey friend. My name is Shalae and here on this channel we discuss shopping, saving, and everything in between. I would love to have you a part of my internet family. Super easy. Click the big old red subscribe button down below and you're in just like that. And while you're at it, go ahead and give me a like, especially if you love me bringing Medicare content to you. Guys, this is my first time actually tackling this subject, but there's so much going on and I thought it would be just good, right? So let me know if you like this or not. Now, if you want to try out Amazon Prime free for 30 days, it is my gift to you, my darling. All you have to do is click that link above, sign up. You will get your items within sometimes 24 hours, but at least 48 hours. As well as if you want to do exactly what I do here on YouTube, run my mouth, go ahead and grab a copy of my ebook for $14.97. Guys, I teach you the tips, tricks of YouTube. If you have someone that wants to get on YouTube in your family, go ahead and gift them this holiday season. All right, so let's go ahead and kick things off with Medicare. Last month, the Center of Medicare and Medicaid Services, they released their 2023 premiums, deductibles, and coinsurance amounts for the Medicare Part A and Part B programs in 2023. Now, they also released the Medicare Part D income-related monthly adjustments as well. So as you can see here, the standard monthly premium for Medicare Part B enrollees will be $164.90, which is a decrease by $5.20 from last year. So I remember a lot of my seasoned seniors last year was like, hey, you know what, on the Social Security side, we have an increase, but now we're paying more in Medicare, right? As we all know, Medicare Part B, it covers like your physician services, outpatient hospital services, doctor's bills, even certain home health services, durable medical equipment, diagnostic testing, or even preventive testing, ambulance, and a lot of other medical and health services that are usually not covered by Medicare Part A. Now, there is a deductible that you would have to meet before the Medicare coverage will actually kick in on those services. But in 2023, the deductible is $226. Now, this is a little decrease, right, of $7 because in 2022, this year, we know that it was $233. Thanks to the Inflation Reduction Act that President Joe Biden signed into law in August, Medicare enrollees will now see lower costs as well when it comes to insulin and vaccines in 2023. So starting in 2023, all people with Medicare who take insulin that is either covered by like your prescription drug plan or through a traditional pump covered under the original Medicare will pay no more than $35 in cost sharing for a month's supply of each covered insulin product. Now that is a drastic savings, guys. People with Medicare also will not pay a deductible with respect to each covered insulin product. So I think this is definitely a win this year. Now, people with Medicare drug coverage, you will pay nothing out of pocket as well when it comes to adult vaccines. And this is including the shingles vaccine, the tetanus, diphtheria, whooping cough vaccine as well. Now, there are some changes that are happening as well because like certain Medicare enrollees who are 36 months post kidney transplant, you are no longer eligible for the full Medicare coverage, okay? So you can elect a Part B coverage of immune suppressive drugs by paying a separate amount or a separate premium. Now for 2023, the immune suppressive drug premium will be $97.10. So here's the income adjusted amounts for 2023, which as you can see, they are lower than 2022. But remember, the government looks back at your adjusted income gross from the 2 years prior. So in 2023, they're going to actually look at your adjusted income gross from 2021. And then of course you have like your different tax statuses as well. So if you are married or even married filing separately, all right? Now that Part B is decreasing, Part A deductible is increasing by the hair on our chinny chin chin. In 2022, it was $1,550. Now it goes to $1,600, as well as like the daily co-insurance and skilled nursing care. All of those are increasing as well. Now, Part A covers inpatient hospital care, as well as nursing home care, hospice care, and even home health care. These services are usually free, which means there's no premium to pay. But we all know, like this weekend, it did kick off open enrollment, which applies to your Medicare Advantage and Medicare Part D, which is your prescription plan. Now, these are the plans that beneficiaries can update during this annual open enrollment, which began on October 15th and is going to go through December 7th. So eligible individuals can switch from original Medicare to a Medicare Advantage plan. You can go from a Medicare Advantage plan back to original Medicare. For one, like Medicare Part D, which is that drug prescription plan, you can now find another. You can enroll in a Medicare Part D prescription plan if you did not enroll when you were first eligible for Medicare. So if you are enrolled right now in a Medicare Advantage plan or even just a Part D prescription drug plan, I would highly suggest that you do a checkup on your plan. And this year it's like more vital than ever that people with Medicare like you review and just compare your options to find out, are you on the best coverage, or does this meet like your needs? Like, is this best for you? Now, in terms of your Part D coverage, you can change that from year to year in ways that affect not only your costs, but even access to medication. So like the same is true for Advantage plans that wrap up during the coverage, and the healthcare providers included in these that are managed by the networks as well. They can also change. So I would highly suggest that you look into these things and some of the things that you want to consider when you're shopping for your Medicare coverage. First, you want to start by like reviewing your annual notice of change letter that usually comes out in the fall regarding your Medicare prescription drug or even your Advantage plan provider. Now, these annual notices will usually detail like any changes that are going to happen as far as like cost sharing in the upcoming year, specific medications, what your current plan will have or won't have, or even if a specific drug will be covered. So if you're going to select like a Medicare Advantage plan, you definitely want to check with your healthcare providers just to confirm that they're still going to be in your plan's network. If you are selecting just say a Medicare prescription drug plan, then you want to check and make sure that the drugs that you're currently on or using are included in the plan as well. Now, also remember that just because it may be a low monthly premium, this may not be best for you in the overall value of your specific needs. So I can't tell you what plan is best for you because it is personal and it's based on what you have going on. But I would definitely tell you to go ahead and review your plan. And we all know that it's always about the money as well. So review a plan's estimate total cost to you, including like your deductible as well as your out-of-pocket costs. Now, here are some ways that you can look at to compare plans and even maybe save. Of course, you can always go to like Medicare.gov just to learn the difference between your original Medicare and then Medicare Advantage plans. And what I like about this option is they do like a side-by-side comparison of cost as well as coverage for Medicare Advantage and prescription drug plans as well. If you don't want to utilize that option, you can always dial 1-800-MEDICARE. Help is available to you 24 hours a day, including some weekends as well. You have access to personalized health insurance counseling at no cost. A lot of times these are available from the state health insurance assistance program, which is also known as SHIP. I know that certain banks are even offering talking points where different members can come in and learn about Medicare, as well as news outlets. So there's a ton of information that if you need help in making that decision on which program or which plan is best for you that's out there, just take advantage of it. And guys, this is what I have when it comes to Medicare. Like I said, we are in open enrollment right now until December 7th. I am super happy that the costs have decreased some, okay? Definitely let me know, are you excited about this? What do you think about the insulin coverage? As well as, were you excited about the Social Security increase as well? Do you think this year is better than it was last year? Let me know all the things down in the comments below, as well as if you do not have Amazon Prime and you think that you want to try it out just for 30 days free. I mean, it's free, right? Go ahead and click that link down in the description box below, or click the link above and definitely get you some Amazon Prime. And if you want to do exactly what I do, get on YouTube, make videos, or maybe you have someone that's very outspoken, definitely grab a copy of my ebook and send it to them. I will deliver it directly to their email address and they can get started today. And that's all I have, guys. Please like, comment, subscribe, and I will talk to you later. Bye, guys.